Autonomy, connecting communities, empowering autonomy. And the goal is definitely the everything app. It's not just a back office for home health care. It's not just a tool for staff or training. It's really an everything app. And that's been definitely one of the goals. And for the everyday user, the everyday consumer, you can transform your smart device into a hub for a community and and I came up with this idea while um, really interacting with the community as I was rebuilding the property. And I noticed that without really knowing if everyone is working at a high level standard of service delivery, it's hard to trust other businesses or um, in a B2B type project. And there was a need to, and there still is a need to help these organizations really um, provide better service delivery, be in compliance when providing services, and ensuring that those customers or clients have a great service or product after you're gone. And that's really at the core of the autonomy application. And so, building on that, businesses can sign up and use the communication tools, the back office tools, the time and attendance tools to keep track of their staff, keep track of compliance requirements, really put their business on autopilot, um, as well as any other training to onboard staff to um, make sure that you could focus on what you do best, whatever that may be. From a client or consumer standpoint, they're able to discover their local area, find your business, connect with your business, communicate. It's called conversational commerce, where they can eventually purchase items or plan a visit on their in app calendar, where they can schedule their day visiting different businesses or even um, planning their entire day. They can do that in the autonomy application, whether it's training, whether it's going to school, whether it's planning a meal event, whether it's planning a family event, or um, just attending a live event in person or even online, not just playing games online. It's really a all-in-one everything application, and that's really what we're trying to offer because providers within the autonomy network, they have clients that in some cases are receiving support services where it could take them a little bit longer to reach their goals. And um, with these types of telehealth type features, they'll be able to continue to connect and improve their social determinants of health and get to know more people in their local area. They can collaborate, they could also plan events with other people, they can chat with people in public places. You can share events that you want to participate in with families or friends. And you can add to your calendar with alerts. During our CEO call earlier, I was talking with the CEOs about the different types of prompts the autonomy application offers: indirect, direct, hand over hand. It's You can't have a hand over hand with this software, but the providers that use autonomy, their direct support professionals can offer that hand over hand prompt if needed, based on the activity and individual support plan. Can even go further based on mood, based on location, um, based on overall goals that the individual wants to reach, and that's really all that matters. We want people to be as comfortable as possible when reaching their goals, when participating in activities. So we really continue to try to upskill these DSPs. And as we incorporate more and more technology tools to help these DSPs remember the 50 to 100 pages in the ISP that's needed, remember that at this particular location, if you say this, it could trigger a behavior. Those little details about an individual are really needed while at the point of care, and we're able to offer that within the application and give those tools to our CEOs as well as staff. As far as CEOs, our network is nationwide, and we're able to use our knowledge and feedback from the different Medicaid and Medicare officials on a weekly basis to continuously improve service delivery across the entire network. Okay. So it really helps service delivery across the board, and it's really hard for a CEO to make a recurring mistake. So as far as a plan of correction, a, a plan of correction within the autonomy network is not a regular plan of correction. You're really have the ability to not only improve on that specific area, you now have a lot of data to um, back you up on how you're improving those specific areas that failed before. Within the application, we are able to keep you in compliance because everything is there in a paperless environment. No matter where you are, you're able to have access to your entire back office as well as have access to communicate directly to your staff, uh, whether it's through a call, through a chat, through a video conference, or even a scheduled meeting. It's all paperless, all email less in this all-in-one application. Right? And as we improve the technology, the goal is for our CEOs to have less and less headaches. Some of the headaches that I experienced while providing support services with my agency, they're definitely feeling a lot better and growing. So the goal is to continuously improve and make the back office more and more efficient with the changing regulations. Each state different, and the regulations are different and changing month to month. You can even have a reviewer who maybe wants additional information related to the regulations. So I really like the opportunity that autonomy offers the general public. These yellow drop pins that you're seeing here allow anyone in the general public to start training for free. All right. Again, these trainings allows anyone in the general public to train for free based on your state. So if you log into the autonomy application, for example, in Maryland, you'll have a different type of training offering than someone in Pennsylvania or Virginia or New York, where these trainings that are offered are really helping the DSPs see a 5-10 year plan where they're able to receive mentorship from clinicians, real experts, licensed on an ongoing basis. All right, it's not someone who's inexperienced or just decided to start an agency to provide services. Yes, there is revenue to be made, But with an expert at the helm leading the pack with autonomy managing the back office, it's a win-win for everybody, the entire team, right? The DSPs are able to be upskilled, so as they go through the trainings, they're able to receive ongoing support and mentorship. They're also able to go through a 6-month training, a combination of online and offline trainings to get upskilled. And what I mean by upskilled is no matter who they're working for, we want to empower them to have the skills to demand more money, because they've been through history been paid very little. So we want to give them the tools and knowledge to do better. And they're given that opportunity right here for free, where they can start training once they complete the generic trainings. They're able to go through our DSP 123 upskill program for free, where they can really demand a living wage no matter where they decide to work. Home healthcare is everywhere, but with the tools and skills that they're able to that they're able to receive and experience through the autonomy application, without a doubt, their resume will look 10 times better than any other agency. Okay. Um, with the tools, they can bring better communication to the team. With the knowledge of regulations, they can help not only the CEO or a large organization, they can move right into a supervisory position or a more skilled position where they're able to know and understand the different parts of the ISP. They're able to talk as if they understand the ISP. They know where to look for know and do and different things that tick off a specific individual. Know what to do in case of emergency. Those little details, the staff need to know those things, but they also need could use a way on finding it very easy within the application at the point of care. So what I call this is the healthcare draft. It's not really as an NBA draft, but it's a home healthcare draft where you're able to receive this opportunity and really, um, if you put the hours in as if you are going to the NBA or NFL or NHL, or where you're expecting a large salary, that same type of return on investment can be received if you own your own home healthcare business. And I'm hopeful that more and more DSPs will see the industry as an opportunity to go back to school and get their bachelor's or even their master's degrees, to be a part of that interdisciplinary team, or even be a behavioral specialist and bring that extra knowledge of behavioral supports to that interdisciplinary team. It's definitely needed as more and more people bring care into the want care in a community like setting instead of a nursing home, where they're close to family and friends and really are able to get out in the community, walk to parks if possible, or participate in activities of daily living. All right. Again, the goal of autonomy is that an everything application that includes training, chat, video, conference calling, screen sharing. Um, you're able to go paperless. You're able to take time and attendance. You're able to keep track of expenses and revenues. Um, the training is customized. It automatically adjusts to your training style. There's so much that's incorporated and have been built out through the years. It's a tool that you can use for every day, and I'm hopeful that you will use it. Thank you, and have a good rest of your day.